So I'm going to show you a technique that you can use at home to help take pressure off your neck. This is a nice self-traction technique to help decompress the spine. This can be very useful for pain in the neck as well as disc bulges that can cause pain that runs down the arm as well. And it's very easy to do. Stay tuned. Alright, so for this technique, I'm going to use a piece of resistance band here. I've got a knot on either end of that, which will serve as an anchor as I place this in the door. And when I create the loop on the other end, I'm going to tie that in a way that it's going to reach behind the neck at this bony part here called the mastoid process. And that's where I'm going to anchor it for my traction to occur. So, what I'm going to do here to start is place both ends with the knot at the lower part of the door, roughly, let's say about a foot off the ground. I want to test it here as well just to make sure that that band isn't going to go anywhere. I also want to make sure no one's in that room going to open a door anytime soon. So I'm going to just place myself in a position so that I can place the back of my head inside of that loop. And that's going to wrap nicely around my head here. So once I've got it firmly secured, what I'm going to do is scoop my bum away from the door. As I move further and further away, that band and resistance is going to pull back, causing that traction. Once I'm in a comfortable position, I just want to make sure to relax here and let the band do the work. It doesn't take a lot of pressure to do what I need it to do. The joints between the spine are really small and it doesn't require a big, large pull. This should be a very comfortable technique and there should be no pain at all from this. There shouldn't be any additional pain that goes into the arm either. In fact, that should help release any discomfort going down the arm as I lie here. And I might spend about 30 seconds to a minute in this position before I readjust or take a break. That feels good. To release, I'm going to scoot myself back just to make sure I'm taking some of that tension off of the band, and then I'm going to take it out from underneath my head. It's important to make sure that you're not feeling any extra pain from doing this technique, then make sure this is the right technique for you. Certain conditions might feel worse with traction, whether it be self-traction or manual traction that you would receive in a clinic with a physiotherapist. So it's important that you don't feel anything extra in the way of pain while you're doing this. If this is an effective treatment for you, it should feel good pretty well right away. Don't forget to subscribe so that you can hear about more videos like this when they come out. Thanks for watching.